We continue our series on monitoring hormone therapy, where we're going to try to help you navigate through these sometimes difficult questions regarding which type of test, serum, saliva, or urine, works best for a particular situation. So how do we know what type of test to use for different HRT situations? And in this session, we're going to focus on topical hormones. So we're talking exclusively about transdermal gels and creams, so those that are applied to the skin. So what we find in these situations is we get this pretty extreme dichotomy that creates a lot of confusion. So if you look at these two individuals and you look at their serum values following the application of a progesterone cream, you can see the levels are about 1/10 of a young healthy female. So a young healthy female is going to be around 10-15 nanograms per milliliter, and these women's levels really aren't increasing above baseline. So the translation, there's no progesterone. However, the same individuals with saliva at the same exact time, one of them shows about a 10-fold increase over a young healthy female, and another shows a 100-fold increase over a young healthy female. So that's a pretty big contrast. So what's going on? So saliva values go way up, serum or urine goes up just a little, and oftentimes we might think, well, perhaps only the free levels of hormones are increasing. And that might make sense, but that just isn't the case. So we can see testosterone following transdermal testosterone application. There are your total levels, and here are your free levels. And so when you calculate the percent free, even over a 90-day period of time, you don't really see much of an increase in terms of the percent that is free. So what we really see with topical hormones is the increase in concentration. It simply depends on where you look. You get this small increase in serum, and you see the same thing in urine. You get huge salivary increases, and then to add to the puzzle, and in a way to add to the confusion, we also see kind of a moderately high increase in terms of the levels in capillary blood. So we're talking about blood that comes from a finger stick. So we can see in the same individuals, and thanks to Dr. Stanzik for sharing this data and allowing us to share it with you, you can see that the capillary blood goes up from about the level of a young healthy female to about 10 times that over the course of the day. And you can see again, here are the serum values. So taken at the same time, again, no serum increase, pretty big increase in terms of the amount of progesterone that's in the capillary blood, and again, the salivary levels are very high. So this leads to a lot of questions. I mean, what's really going on if we've got these three different lab values doing very different things? So let's take a step back and look at the clinical picture. So if we look at testosterone, we can look at the clinical picture and see what happens to LH. Right? So when we give too much testosterone, the brain responds by shutting down LH production. As an example, when 100 milligrams of weekly injections of testosterone are given, usually LH will go down entirely. So let's look at transdermal testosterone with a 50 milligram gel. So saliva goes up about 15-fold. So that would tell you, again, the message being there's a lot of hormone, probably too much hormone. But if we look in urine or serum, there's just a modest increase. So it's a completely different message. So what message is the brain getting? What happens to LH? So we can see in this study, these are hypogonadal men. So this baseline of LH is actually an elevated value. Okay, and again, we know that if we give too much testosterone by way of injection or some other means, you can get LH to go clear down to 0. And you can see with a 50 milligram dose, that's the intermediate dose here, the LH comes down to these levels, and it's kind of hard to see here because there's not really a scale, but that put these men right in the middle of the reference range. So the LH suppression implies more of a modest dose, which agrees more with the serum or urine testing. And another point, which I think is a big one, is that the muscle increase in these studies was only seen if the serum went up. Okay, so changes in lean body mass with the lower group here, the distinction between these two groups is in the left group, the serum values aren't going up significantly, and in the right group they are. And what we see is that the muscle mass increase is only seen in the group on the right, where the serum values increased, but we can guess fairly well that with these doses, even the men on the left are going to have very high levels in terms of the increase that you see in saliva, because you see levels that will go up 200-300% with even a 5 milligram dose on average. So even these men whose serum values aren't going up, there's probably a very large increase in saliva. So does that actually reflect what's going on systemically? This would imply that perhaps it doesn't, but what it does tell us is some tissue do get a lot more hormone, and that's a profound message. And the capillary blood then confirms that some tissue are getting a lot more hormone. Now, another point to make about salivary testing, which I think is important, is in this small study, they showed that when you put the hormone close to the saliva gland, or you put it very far away from the saliva gland, the difference you get, this is an exponential scale, a logarithmic scale, so you can see that the difference there is orders of magnitude different. So where you put the hormone is going to make a big difference, and what we may have going on here is that if the hormone is applied to the skin, the hormone may not be getting into systemic circulation very much, because if it did, you would expect to see results different in terms of the muscle mass increase and in terms of the serum values. But what we may have is the hormone getting to the saliva gland by a different mechanism that's more of a diffusion of sorts as it goes through potentially lymphatics or subcutaneous fat. I mean, we really don't know, but what we would expect to see in this type of model is higher levels of hormone if you put it close to the saliva gland, and lower levels if you put it further away, and that is actually what we see. So there's a profound message in saliva testing with transdermal hormones, but when you really want to look at it as a monitoring tool, when, for example, the variable of where you put it makes such a big difference, it really isn't going to work that well as a monitoring tool for topical hormones. So if we look at a situation like this is rather interesting. We've got one individual who's simply changing the base in terms of her testosterone, and you can see these values here actually brought down to 700, even though some of them go up to as high as 2500, just so you can see it a little bit here. But we changed the base, and it's possible that they got the concentration wrong or something, but what we note is that if you test a day later at 24 hours, you still have an elevated value, and you have a pretty similar value at 12 hours, but the story that's gone on over those first 8 to 10 hours is quite different in the saliva gland, and again, that's going to be different than what's going on in the blood, and so trying to get a clear message out of that is going to be rather difficult. So probably the most profound conclusion we can use with topical hormones doesn't involve as much which test we use, more so that we need to be very careful in terms of chasing lab values with HRT, particularly with topical hormones, in that if you're chasing a serum or a urine value, you're probably going to end up using hormone concentrations that are going to potentially overdose your patients, and where in some tissue are going to be overloaded with hormones, whereas if we're chasing values in saliva, there's going to be a lot of variability there in sample-to-sample collection, and also other variables that we simply can't control, and so making those values meaningful is quite difficult. So this particular session potentially ends with confusion, but we hope you'll also watch some of the other sessions where we're looking at different routes of administration, where there are clearer answers in terms of what type of test is going to use well and what types of values we need to be looking at. And so if you'd like to contribute to this conversation, or you have questions or information regarding our testing is requested, you can simply email us at info@precisionhormones.com.